Good afternoon. Welcome to 𝐻𝐶𝐓 Academy Reading Live. I am Vinod James. Welcome to another lovely session. Even though I know that you're all busy working. Few of you have written the exam. Few of you are eagerly preparing for the exams. But although I missed all of you, so welcome to another lovely session. Monday morning. As always, it's so energetic to find out, to meet all of you, to eagerly waiting to see how many of you are there attending live sessions. Okay, so all those things are always in mind. So, welcome to another lovely session with 𝐻𝐶𝐓 Academy. So, what are the things that you have to be very cautious about? Okay, we have been doing regularly whatever that we get new insight. We have always tried to make sure that you have been taken into the utmost consideration. Okay, not just about one particular area. We've been expanding our wings to every single examination that is available for making our students reach their dream destination. Atira Sally, good afternoon. Tansy, good afternoon. Sophia Agasti, good afternoon. Shine Johnson, good afternoon. So we have latest addition on a lot of new exams that has come into. That's very much stipulated on if you are an aspirant who are really eager to go to Canada for migration or for work. There's another exam that will come, not at all, which is based on academic. It's a non-academic examination, which gives you more of a day-to-day life scenario, a real life scenario based on exam. So if you want to know more about it, please do not hesitate to contact the number. And also do remember that all these things will be coming your way. So do not forget to click the like button, click the share button, click the subscribe button, and click the follow button, because no sooner our colleagues are going to come up with a lot of insights on all these exams that is going to come your way. So do not forget to like, subscribe, and follow the very same page. Sidhu, good afternoon, Bangalore. Kalpana, Manipur, good afternoon. Christina Rose, good afternoon. Jilmi Joy, good afternoon. Shine Rose, good afternoon. So there are a number of things that is happening which we might not be aware. I'm sorry, you might not be aware. So we would definitely know, and we would see what are the things that is going to benefit you. So we are literally going to do every possible thing in order to make sure that you all reach your dream destination. Arunima Rajan, good afternoon. Jilmi, good afternoon. Shiny Rose, good afternoon. Merinummen, good afternoon. Naji Rachel Matthew, good afternoon. Shiny VS, good afternoon. See if you are, one particular, see, for example, nurses. Okay, there are few exams which is very much stipulated if you are an aspirant to go to certain countries. Okay, there are few exams which is if you really want to settle in certain countries. So all these things are a possibility depending on what are your priorities. See, if UK is your priority, of course. If Ireland is your priority, there are few other options. If Australia and New Zealand are your priority, there are few other exams. So likewise, you have to know. Understood? So if you want to know more insights, and see, it's not as easy. See, let me be very straight to you. Okay, no exams are easier to each other, but see, certain exams, certain modules can outweigh. That's how it is. So depending on where you are, what is your exposure, which one are you okay with, which one are you not okay with, depending on that you can always get over this. Okay, Aji Rachel, good afternoon. Ammu Abi, good afternoon. You name Ammu? Anija, good afternoon. Atira, good afternoon. So what are the things that you have to really look into? Okay, these are why you have to get a completely professional way to get over that. Because most of the students just refer some unethical or not credible areas where don't expect that whatever that they're going to say is simply don't swallow it. So you have to get an absolute right. See, always when you're referring for any exams, always refer that particular exam people's official site. Get information from that, or you get into certain places where there are affiliated partners, you get through them. Okay, don't simply look into the aspect. Okay, Rasna Suraj, good afternoon. And we have just pinned the 𝐁𝐸 Academy social media platforms. So please do join that so that you will not miss any of these insights. Okay, because we have a lot of things in resource for all of you to be benefited. So always make sure that you have liked the page so that you do not miss any new thing that comes. You will get the intimation the sooner that we post. So don't miss that opportunity. Anjunaya, good afternoon. So today we're going to talk about what you are here. We're going to talk about how to get this 20 out of 20. Okay, see, I don't know whether how many of you have done the grammar challenges or doing the grammar challenges. Tito, hi, how are you? Missing your reading classes? Tito, very, very, very sweet of you to come and say that. Okay, I do remember every time when that name pops up for my regular students, it always have that face. So very, very nice to see you in front of me after some time. I hope your preparations are all going well. I know that you've been there into all these 3 months of practice, isn't it? So do not worry. Whenever you want, I'm always here right in front of you. So happy, very, very sweet of you to show that sweetest gesture. Okay. Just small George, good afternoon, but not all will miss me, isn't it? Because I'm a terror there. Fair enough. Now, going back into what is today's thing, because from 2024, we started talking about certain important aspects that you have to enhance on the aspect of getting your dream score. So today we're going to go back to the thing on the aspect of 20 out of 20. Ashwati Vijayan, good afternoon. Hope you all are doing good. Ashwati, very nice to see you as well. We're all doing good. So nice. I hope all of you are doing excellent in your places. Sini Nikle, good afternoon. Neetu Nikrishnan, good afternoon. Lot of profound names today. But before going into anybody attending the live for the very first time, Angana who is here for the very first time. If so, please do let me know that you're attending for the very first time. And also where you're from, because I love to update my known people's list. Because, now I can proudly say I have almost everywhere across the globe, you have people whom you really know. Right, now 20 out of 20. See, 20 out of 20 is not something which is too much difficult. Okay, I'm not saying it is not possible. It is possible. Okay, few things that you have to always remember, because we've been talking a lot of things on the aspect of what you have to really look for. Okay, if you really look into the 2024, the live session that we've been doing, we are trying to incorporate a lot of insights on the aspect how to get over that. Again, Geeta Molskaria, good afternoon. Anu and Jose, good afternoon. See, I would always request all of you to do like, share, and subscribe. Why? Because I would like to see at least one icon next to your name, because it's such a, like a so happy thing to say, at least when you see your name, at least one icon next to you. That shows that how much of a support that you're showing to 𝐁𝐸's family. Tangasudha, good afternoon. All right. And share. See, share is not for any other reason, okay? Because that is for me to gauge about my classes. Because the more you share, that means the classes you feel that it is beneficial. Because you would never share something which is not going to have any effect on other people, isn't it? So when you share, I know that you feel that yes, it can have an impact on another person. Maybe a known person or an unknown person. You will never know, because there are many students who are still available, who are, waiting for such kind of free classes. So when you share, when they see, they also get that opportunity to make sure that they reach their dream. Darshini Selva, good afternoon. New name, Rija Bilash, good afternoon. Right, now 20 out of 20. See, 20 out of 20 is always a possibility. Is always a possibility. Okay. See, now the thing is about grammar. Today I just spoke about, because when I saw the grammar challenges which has been posted, not much of the students are doing it. Okay. Now why again I keep on emphasizing it? So you have to understand grammar does play a role or do play a role in getting over that 20. Okay, now why? See, it is not because that you are literally going to search into it. See, for example, in a fill in the blanks question, or let's say a short answer question. Okay, the question is, what are the injections that needs to be administered for certain condition? Now, let's say if you can identify, okay, what are a singular or plural, injections, singular, plural. So you could definitely relate it on the aspect. See, I am expected to write one answer or more than one answer. That's the question. See, when you can trigger that, obviously you will not write one answer, isn't it? Just imagine if you're writing saying that only one answer. Now, do you think, even though maybe that one answer is right, do you think that you will get that 1 mark? No, but students doesn't realize it. Understood. Thank you very much, Ismail. More than one. Of course it is. So when you write those two only, you will get that mark. Understood. This is the importance of grammar into it. Understand? It's not that. See, there are places where which patients. I always love those kind of questions. See, which patients? Okay. Now, what happens? A student, when I ask the student to read, the way they read itself, you can gauge whether they're going to tell me the right answer. Why? Because the student reads it at which patient need to do certain thing. Which patients is the question. But when a student read it as which patient, is that student going to understand that I am expecting a singular answer or a plural answer? Okay, see, these are the differences that you have to always remember. See, when we post our grammar challenges, there is a reason. Okay, when that is also another reason why you have been asked, have you clicked the like button? Have you clicked the subscribe button? Have you clicked the follow button? So that all these things, when we are posting, it comes to you. If you have not yet joined the Telegram page, please do join. If you have not yet joined the WhatsApp channel, please do, so that every time you are surrounded by something which is informative. Understood? You have to literally make use of this. See, maybe today in my class I was emphasizing the importance of being wrong. No problem. See, do wrong, because we are here to correct you. Understood? So please understand there are reasons why certain things have been given into. See, we do a lot of informative videos which is there, but when I really look into the students who watch that, is very minimal. Now why? See, you have to understand these are, see, for example, when you use a word called please, okay, and if you don't use a word called please, is there a difference? Of course. See, you might say come here. Do you think that when somebody calls you like that, do you think that they're calling it with respect or without respect? Very simple, without respect. But it's not the person who's calling you will not feel it, because that person feels that, oh, okay, you are asked to come. Understood? But you're going into an English speaking country and you should know what are the things that you have to, the etiquettes that you have to follow. Understood? So there are a lot of significance on these kind of things. See, you have to use certain places, you have to say, please come here. Okay, on top of that, there are intonative factors, intonation on the aspect. See, the way you say, please come here. No, those are all differences. So this is why you have been given a lot of information. If you really look into the page, the very same page that you're watching, you see a lot of things, including videos, including a lot of explanations about each word. See, try to look into all those things. I'm not saying do swallow everything that is there. See, depending on a student's perspective. See, please, for example, there are students, n number of students who use that word. They know it. See, so that person doesn't, maybe that video will not be, they wouldn't find it interesting. But there are other videos which can. You always try to find out something that can improve what you are or where you are. Understand? So you can't just simply ignore it. Just try to see. Understood? So today, to give that emphasis on 20 out of 20, this is a mistake that generally a student doesn't get that 20. See that 19, 18, I'm not saying it is bad. But what happens is, you should always understand, see, on the day of exam, I'm going to score 20 out of 20. But that's a huge thing and a huge impact on your thing, on the aspect of from your dream to become it a reality. Understand? So please do utilize whatever it has been said. And the reason why these are all being pumped into is to make sure that you all attain that 20 out of 20 without even much of a fuss. See, when you start differentiating this, when you start identifying these kind of small, the things that we seldom do, and that is the place where these kind of mistakes happen. And then from there, you can definitely correct it. See, there is no hard and fast rule saying that you can't correct it. You're always welcome to correct it, provided you should know what is the right way to correct it. All right. Sandhya Bijoy, good afternoon. Prince Eldos, good afternoon. I hope what I just said will ensure that next time when you're reading a question, you will look into this. Okay, so that you do not miss that 20 out of 20. So are you all ready for today's session? If so, give me a quick thumbs up. Let me see how many are very eagerly waiting for today's session. Let me see. Okay, because I have always mentioned this is a virtual reality. For me, even though all the students are there in front of me, but I could literally feel that. But the only way to know whether you were all there actively participating is by your response. Shiny is ready, Anija is ready, good enough, Tangasudha is ready, good, Jilmi is ready, Anjuna is ready. Savit is waiting, okay, fair enough. Ammu is ready, good enough. Mahima is ready, good. Christina is ready, good enough. Siddhu is ready, good. Just small George Gutte is ready, good enough. Savit ready, triple ready, is it? 3 thumbs up, good enough. Anjali is ready. Danuja, ready, okay. Saumya Jobin, good afternoon. Shine Johnson, ready. Sandhya, ready. All right, good enough. So as you all ready, Neetu Unnikrishnan is ready. You will have the material coming on the screen. Maria Chinnabattini, good afternoon. Shari Sunil Kumar, ready. Anju Stephen, ready. There are a few names which I have already told. I have not read those names. If there is anybody who is new, please do let me know where you're from as well. Kalpana Reddy, Sophia Reddy, Kavita, good afternoon, Reddy. There you have the material. Please do the material and then we will discuss. Right. Time of just exhausted, isn't it? So 𝐵INCI Prince was ready, Merriman waiting for part B, Reja ready, Sidhu done, good enough. That was the first person to say done. Good, good, good. I hope all of you were able to manage time. Did you? This small is saying done. Good enough. Maria is saying done. Good. Tangasudha done. Anjuna done. Christina done. Good enough. Good, good, good. Sandhya Bijoy done. Right. Priya Rakwell done. Okay. Sophia Agasti done. Fancy done. Right, Neetu Krishnan done. Would you be kind enough to tell me what is your answer and where you got that answer from? That where is very important. Yeah? Not just what is your answer. I want you to tell me where you got that answer from. Savit done, Anija done, good, Jean Bino done, Rasna done. Right, tell me, Sidhu B from first para. Okay, fair enough. So the first answer that I have is B. What about others? See, do not worry about whatever that you have got as an answer. Do let me know. Tell me, what is the answer that you have got and where you have got that from? Tangasudha B, last para. Okay, fair enough. So both B I have, but I've got it from two different places. Fair enough. How about others? What are the answers that you've got and where you have got that? See, this is where I would always request all of you. See, do not worry about others. Your job is to say, I got this, A, B, C, no problem. We are here to learn. Anija B, last para, Savit B, first and second para. Okay, fair enough. So throughout they're saying us about that. Okay, fair enough. B is what I have. Jean Bino saying C from middle. Okay, fair enough. So the first person to say, no, it's not B, it is C also. You have to always remember, there are times, Sandhya Bijoy, B from second para, where all my students have got it right. 75-25 have got it right. 50-50 have got it right. And the other way around also. 25% have got it right. 50% have got it right. 0% have got it right. 1% have got it right also there. So you always have to remember, it doesn't matter what are your answers. You have to tell what is your answer. Maria B, first and second para. Kavita Vijayan B from first para. Sophia, for me also, C. Okay, good enough. So B and C are the two answers. Now let's see whether if it is B or if it is C, or you would never know. It can be A as well, isn't it? Because they all give everything on the aspect of coming in. The three answer options are given because it can or it is a possibility if you read somewhere. Okay, depending on how your comprehension. So the material will be popping up back on the screen and then we will discuss. Okay, now what are the important things that you have to always remember? Danuja B. See, first and the foremost important thing that you always have to remember is reading the question. Three important things, please do. One, read the question, underline the keywords in the question, understand the question. Very, very, very important. Okay. Now see this question. The aim if this trial is to. So this not if, I think it should be of. So aim of the trial. So what is the purpose, isn't it? Or the main thing about it. Now let's see what are the options. Check if burns heal at the same rate. So something to burns heal at the same rate as diabetic foot ulcers when the same dressing is used. So same rate, same dressing. The other is okay. You can relate it. Okay. Now let's see. The only thing is if the burn heal at the same rate as diabetic foot ulcers with the same dressing. Then to see if a spray on skin dressing saves money. Not only saves money, improves outcomes. So saves money, improves outcomes. So not only that it is cost effective, but also it is effective. Okay, treatment effective. See if patients getting care in outpatient department. So outpatient department heal quicker than those having care provided in their own home. So outpatient quicker, own home. So something to compare. Okay, this is not these people are. Understood? This is how you should. So what is that? What is the main aim of the trial? So spray on skin for diabetic foot ulcers, an open label randomized controlled trial. A novel, see now the word novel, okay, it's very prominent in part C and all. Novel means new. Okay, a novel intervention towards achieving these goals is to use spray on skin for patient with diabetic foot ulcer. That's the acronym for DF, or that is the acronym of DFU. The application of spray on autologous skin grafting aids epithelial regeneration and wound healing and has been used successfully for the treatment of burns to improve healing. So I forgot to mention elimination is the sweetest strategy. So nothing to do with whatever the three options. Reading further. Successful improve in research product, we will compare spray on skin with standard care in an open label randomized controlled trial in patients presenting to hospital with DFU. They are saying we hypothesize that spray on skin will shorten the time of ulcer to heal completely. So one, they're gonna be shortened quicker. Okay, now quicker is here. See, improve patient outcome is also here. So two places where it is. So at the same rate. So maybe they are also saying quicker. Let's see. So in doing this, the approach can be expected to prevent amputation and recurrent ulceration whilst improving the quality of life. So again, so improve the patient outcome. Quality of life is not there. So this is slightly pointing into B as well. Let's read again. Outpatients' cost for dressing, home nursing visits, and outpatient appointments are key cost drivers for DFU. So it is not cost effective, or is it cost driver? They're saying it is causing. So these are the things that cost. Which one? Cost of dressing, home nursing. These are the thing that increases the cost. Now what happens? If spray on skin is effective, large cost saving to WA Western Australia Health will be released immediately through a shortened time in to healing. So not only that they save, money is also what they are saying. Okay. Now see if patients getting an outpatient department heal quicker than care. No, they are only saying outpatient is mentioned, but this is only about the importance of cost. So literally this is not the answer, but let's see if there is. And through a higher proportion of patients achieving complete healing, any economic benefits are likely to be amplified. That means increased, improved across Australia and other similar demographic setting where aging population with increased diabetes rates are considered major future challenges. So straight eliminator, check if burns heal at the same. Nope. See if the outpatient department heal quicker. There's no comparison. So as what majority of my students, you have all got it right. It is see if spray on dressing saves money. Why? Because these are cost effective. So when this can be done, it is more quicker, so save cost. Not only it saves cost, it improves patients' quality of life. So good enough for people who have got B as an answer. I hope people who have got C understood where that mistake went. You are trying to comprehend onto it. The answers to part B should be mentioned in the given extract. Priya Rakwal is happy. Jismol is dancing. Good enough. Keep on dancing. Kavita Vijayan is dancing. Tanka Sudha is happy. Good enough. So any doubts with regards to question, you may clarify. If not, let's go to the next one. James Joseph, sir, in second para, right? See, it is not just in second para. It is there. Even in the first para, it is talking about being it as quality of life. And the other one is talking about the second para is talking about the cost effectiveness. So both para it is there. Gene Bino clear. Good enough, good enough. Sophie understood. Good enough. See, mistakes are the thing that you understand, because mistakes are the stepping stone of success. Good enough. So all of you understood. Maria is dancing, just Rasna is dancing, Savit is happy. So without wasting your valuable time, let's go into today's part A. So which I've shared is heartburn. I hope all of you have taken a printout and then do the material. See, please do take a printout. Why? Because you have to do as what you do on the day of exam. You have to literally practice. You have to practice writing in that given space. All right. So if you have not yet done so far, do not worry. From tomorrow, please do. That's why if you have not yet joined the exclusive reading Telegram page, that's where you get the first-hand information about what is today's party on the very same page that you get. So please do click all these. Now let's go to the next question. How you felt about today's material and how many minutes did you take to complete it? Atira, Arun, good afternoon. Asha, Tom, clear. Good enough, good enough. Ammu, happy. So tell me how you felt about today's material and how many minutes you took, because we have been emphasizing the importance of doing it in 8 minutes. Savit saying little tricky, 12 minutes. All right. Maria, 14 minutes easy. Okay. Jill being easy material, 12 minutes. Okay, fair enough. Jean being not tricky, 18 minutes. Okay, fair enough. See, you have to always understand. You have to make sure that, okay, today I got it in 18 minutes. It doesn't matter. So others are saying 12 minutes. No worries about others. So you have to go back and see what are the habits that you have in reading. So where did you go wrong? Did you waste a lot of time in one particular question? That's how you correct your mistakes. Okay, so no problem at all. So generally, I have got it tricky, I've got it easy, I've got it tricky. So a bit of more. Now let's see what the material has in stores. I'm going to fire the 20 answers. Take your pencil, put tick, 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 and let me know what are the answers. Now part A, again and again, you will be supplied by part A material initially when you write reading. And then they'll give you 15 minutes, and after that they'll take away the part A material. Then only they will give you part B and C. Anjuna, a little tricky, 15 minutes. Sophie Augusti, today's material is a little bit tough for me. I took 15 minutes. Okay, fair enough. Let's see. Now, what are the things that you have to really look into? So again and again, I always emphasize my students is about the importance of time. 15 minutes, 20 questions. Very, very, very important. Strategy changes. Strategy is called skimming and scanning. Now, what is scanning? You know it. Detail look. Skimming, quick look. That's the difference. Okay. So how much time to do skimming? They say 1 to 2 minutes, but I say 15 seconds. That's all what you can take. Or that is all how much you should take. Because it's very easy. Small text. Okay. So what are the things? You have to underline the keywords. So in order to do that, they have given you 4 texts based on one common theme. So what is today's common theme? It is heartburn. Each text will be different with one pictorial representation, a minimum. Now skimming. Skimming is not about heartburn, is burning pain in your chest. No, that is not the way. You run through the material as you run through, underline the keywords. So keywords, what are the keywords? We have done an exclusive video. How to enhance your part in the very same page that you're watching. Please do take back. It goes a bit long. So go back and see the one which has the maximum view. That's the easiest clue that I will give you. Okay. So see how we're going to skim. Heartburn is a burning pain in your chest. It's just behind the breastbone. This is what it was after eating in the evening and laying down and bending over time. Heartburn occurs in the stomach as it backs and the tube carry forward from the mouth or to your stomach. Typically, the food is swallowed, a band of muscle from the bottom of the esophagus and reflected the food to enter into the stomach. This is Martin tight, and then again the lower esophagus pincer. The stomach gets back into your acid reflux and you cause heartburn. The acid lying done. So I'm not saying that I would understand all those things, but generally they are saying it is starting from here. So you have a burn, so it is in the esophagus and all. Now, when your esophageal lining is injured, the long-term complications. So what are these going to talk about? All the complications. So what are the complications? Esophageal strictures, intestinal metaplasia, esophageal cancer. And text C is talking about a lot of diagnosis, ways to assess under endoscopy, esophageal pH test. So done. Now text D is talking about some study or a procedure. Okay, what happens when a patient with heartburn? What are the treatment? So that's it. So anything with regards to treatment, go where? Go to D. Likewise, you should be able to differentiate. Okay, text A is about this, text B is about this, text C is about the text A. If you can differentiate this, mark my words, 1 to 7 is just a piece of cake. So 20 questions, 3 types. 1 to 7, these type of questions are called match the following. These are all something that you have to buy. You're not supposed to waste your valuable time like that. So question number 1 to 7, match the following. What are the instructions? It says A, B, C or D. So that means which text it falls under. You may use any of these letters more than once. That means you should always remember you can use the same letter more than once. Various strategies for managing heartburn. So strategy is management. Is it treatment? Yes, it is. Where are they talking about treatment? D. Understood? See, I'm not going to talk about, okay, is this where it is talking about? No. So that is how you should. See, issues associated. Issues means what? Risk factors, isn't it? With injured esophagus lining. So where are they talking about issues? During B, isn't it? Those are the complications. See, that is enough. B. Understood? Now, methodology for performing the esophageal pH test. So where are they talking about esophagus pH test? C? Yes, it is. Why? That's where the diagnosis is. It is under one of the diagnostic tests. Under what circumstances is heartburn most likely to reach its zenith? The zenith is a lovely word to talk about. It goes to the maximum, the peak, the pinnacle. So that's how you should. So where are they saying which is in the maximum? It's definitely there in the where? You tell me. It's there, see. Acid flow back into the esophageal and this acid may reverse worse when it bend and down. So that is it. It is a concise term for precancerous condition affecting the esophagus. So concise what condition? The precancerous condition. Where are they talking about? So precancerous is here. This is considered to be a precancerous condition. Which one? It's a term called Barrett's esophagus. So the answer is B. By what mechanism does the occurrence of heartburn transpire? Transpire means occur. So where are they talking about all the occurrence? A. Understood? So symptoms of which ailment? See, this ailments is something that a student always mispronounce. They always say alignment. Alignment is a complete different terminology. See, please understand these are all medical terminology. Ailment. So can be discerned with the aid of upper endoscopy. Upper endoscopy means where? They are only talking about where upper endoscopy. See, I'm not worried about whether they are saying that or not. This is a key word because no other place where I have underlined upper endoscopy. See, understood how you have to, you can easily complete 1 to 7 in a minute. Next set of questions, 8 to 14, short answer question. The instructions are, it can be a word, short phrase. That means short phrase should be anything between 2 to 3 words. It can be words or numbers or a combination of both. Maria is dancing 7 out of 7. Kalpana is enjoying with 7 out of 7. Akila 7 out of 7. Absolutely good enough. Good. So again, strategy doesn't change, but the type of question changes. Okay. What term describes the condition where esophageal tissues undergo changes, resembling the lining of the intestine? See, where are they talking about intestine? These changes and all. So esophageal changes, lining of the intestine. So where are they talking about? It is definitely should be therein. So sometimes instead of scarring, the tissue undergo different kinds of changes. It is called the intestinal metaplasia. intestinal metaplasia. Shine Johnson, Sandhya Bijay, all are saying 7. Excellent. Good enough. The initiation of heartburn treatment is done with the help of which medications? Treatment where? Yes, initiate medicine. So what are they saying? It is done through H2RA or PPI. That's what the answers are. Medication. See, this is that medication. Singular, plural. Plural. So 2 should be there. What is the anatomical passage responsible for conveying food from your mouth to the stomach? So which is the path that is going? Definitely you know what is the path, but you're not supposed to focus on that. You're supposed to find the answer. So where is that? Typically where the food is swallowed. A band of muscle is that? So around the bottom of your esophagus. So which is the thing? It is your esophagus. ESOPHAGUS. Question 11. Dysfunction in which muscular component permits the regurgitation of stomach acid, resulting in acid reflux and triggering heartburn? So where are they talking about all these keywords? So all these keywords are again mentioned. If the lower esophageal sphincter isn't working, the stomach acid flows back. Acid reflux and causes heartburn. All the other keywords are as such there. So the answer is 3-word, lower esophageal sphincter. Question 12. How frequently? Frequently is something to do with time duration. Administration of PPI, go to D. Recommended in a day. So where are they saying? PPI taken once. So how frequently? Once. Good enough. Question 13. The alternative nomenclature. This nomenclature is nothing but alternative term, name for upper endoscopy. Go straight to endoscopy. What are they saying? Upper endoscopy is also called as EGD procedure. Very simple. Okay. Now, question 14. What complications, singular, plural, is another question. So, stem from the chronically injured gullet lining, but are relatively infrequent. See, infrequent is a very, very, very important thing that you have to really look for. Infrequent, if it is given as 2 words, it has a complete different meaning. Infrequent together has a complete different meaning. So complication. So again, complication. Where are the complications? It is there. So what is the complication? Esophageal cancer or cancers. Okay. So which complication? There's an S unwantedly added there. It is complication. So esophageal cancer. ESOPHAGEALCANCER. Good enough. All the other keywords are mentioned. So 15 to 20, these type of questions are called fill in the blanks question. Instruction very similar to short answer question, but here redundancy should be looked into. Dash involves administering the minimum effective dose of acid suppressants to maintain patients in a symptom-free state. So definitely administration and all those things go to D. Now, where are they going? Maintenance therapy, low effective, suppressant, symptom-free state. All those things are as such mentioned. So it's a 2-word answer. Maintenance therapy. MAINTENANCETHERAPY. Good enough. The occurrence of heartburn is prompted. So that means something is triggered when dash regurgitates. So something which throws back, isn't it? So in the conduit means the pipe that transports food from your oral cavity. Where is your oral cavity? Mouth to the esophagus. So something that occurrence of heartburn is prompted. What is the cause of this? So what is the cause? It is your, what is the cause? Tell me. Very simple, isn't it? Heartburn occurs when your stomach acid back into the tube that carries food. So all the other keywords are there. 2-word answer. Stomach. STOMACH. ACI. The wireless capsule. So wireless capsule employed by the esophageal pH testing goes straight to C. Implanted either during or upper endoscopy or through the insertion. So something which is there. So esophageal test is also there. So what is the wireless capsule? The wireless capsule is entered through a nasogastric tube. NASOGASTRIC TUBE. The esophagus acts as an extended conduit inflammation and ensuing following dash induced constriction. So where are they talking about all these? So definitely a complication, yes. It should be under the complication. So some esophagus is a long tube, that inflammation, scarring. So what is the one thing which is missing? Scarring. SCARRING. So that is the only thing which is missing. Endoscopy examination, entail. So that is all very nice words, okay? Internal scrutiny of organs, introducing an. I told you these kind of an, the very next word should be a vowel sounded word, not a vowel sounded word, okay? Into the body. So where are they talking about all these vowel sounded words? Definitely go to C again, because all, I'm sorry. So where are these words? So these words are somewhere in where? It is there in C, isn't it? So endoscopy looks into where? Which is that? So it is passing an endoscope. ENDOSCOPE. Clear? So upper endoscopy, this involved passing an endoscope. ENDOSCOPE. The ultimate question, dash may manifest as stomach acid, so retrogresses. So that is again another word into the esophagus. So that's to regurgitate and all those things. Esophageal sphincter encounters malfunctions. So again, definitely going to go. So where are they saying? It flows back into the esophageal acid reflux and causes heartburn. So heartburn may manifest as stomach acid. So that is it. So I have completed my 20. It is high time that you tell me. If you have any doubts, please do shoot your doubts. If not, please do let me know what are your total scores. Eagerly waiting to see, because the overall perspective about today's material was, some are saying easy, some are saying it is a bit challenging. But Maria Chinnabatini is saying I got 20 out of 20. Sandhya Bijoy is saying 20 out of 20. Absolutely good enough. Excellent. Keep it up. Keep on dancing, isn't it? Why not? Why should you restrict yourself from your enjoying your achievements? Good enough, good enough. Anybody else have any doubts? Yes? No? Today's few of you are very reluctant to shoot the answer scores also. See, do not worry about what others are saying. See, you have to know where you stand. And once you start telling where you stand in a public platform, that shows your courage, your commitment towards it. See, I told 10 today. Tomorrow I'll say 11 at least. That should be the spirit. Yeah, Maria is saying thank you. Sandhya is saying thank you. So I don't see anybody asking any doubts, or neither. I don't see that, because you're not going to tell me your scores. No problem. So until and unless I see you all tomorrow, adios from me. God bless you all. Take care. Bye.